Joining us now, Dr. Jason Wilson. He's the Associate Director of Emergency Medicine and an emergency room doctor at Tampa General Hospital. And Dr. Joseph Varone, he's the Chief of Staff at United Memorial Medical Center in Houston. Dr. Wilson, I just want to start with you in Florida, for instance. You know, leaving the test aside, when we look at the average daily deaths, the chart there, the graph is just rising and rising and rising, a very steep curve in the number of new confirmed deaths, the 7-day moving average. What are you seeing in your hospital?
Sure, we're seeing something that looks a little bit different than what we saw over the previous 3 months. Really starting in June, we started to see very large volumes of young people presenting to us for testing. And once we see that start to happen, we know what's coming. And so in June, we started seeing 200, 300 people a day coming to our hospital just to be tested, asymptomatic exposures. So we knew 2 to 3 weeks later, we would see this lag of about 10 to 15% of that volume starting to be hospitalized. And so then we started seeing 3 to 4 times the hospitalization rates that we were seeing in March, April, May, over that end part of June and now into July. Our case fatality rates had stayed very low here because we had some lead time based off of New York City. We were able to prepare and able to share ICU resources across hospital systems, learn some of the medicine as well, try to keep people from being intubated when appropriate. But of course, as you start to lose capacity and lose the inability to create new capacity, you always worry about those case fatality rates, those deaths starting to rise.
Dr. Varone, that is really striking to hear that it's 3 to 4 times what they had in March, because obviously here in New York, that's when we had, we were overrun by the outbreak. President Trump dismissed yesterday or over the weekend the idea that young people get really sick or that young people are super spreaders. So listen to how he described it.
Many of those cases are young people that would heal in a day. They have the sniffles, and we put it down as a test.
They have the sniffles. Your thoughts on that, doctor?
Well, I mean, clearly, we have a lot of young people that come into us deathly, not the sniffles, deathly. These are people that are on the brink of death. So they're very, very sick. The fact that you are young, the fact that you are healthy, does not by any means make you invincible. And that is something that we need to convey to your viewers. I mean, if you are young, if you're healthy, that doesn't protect you from corona. You are as likely as somebody else to get sick. So you should not use as an excuse to, hey, I'm gonna go out, I'm not gonna wear my mask, that kind of stuff.
And Dr. Wilson, if you can weigh in here, because we've been hearing from other doctors in Florida that recently that the number of older patients coming in has begun to go up. This current wave, I hesitate to use the word wave, this current surge in the hospitals, yes, younger people were the leading edge, but now some older patients are starting to come in as well.
Sure, so older people are always more vulnerable to this, but I think to Dr. Varone's point, 40% of our patients right now in our critical care areas are under the age of 50. And so of those young super spreaders, those young people who come in, we expect anywhere between 5 to 10% of that volume of those same people to come back sicker. 5 to 8 days later, we have to first see them sort of in the pro-inflammatory phase, the cytokine release phase of this virus. They do get sick.
Dr. Varone, you say that you're fighting 2 viruses at the moment, coronavirus and stupidity. And so tell us what you see when you walk out of your hospital doors and how frustrating it is.
Well, I mean, it's really frustrating. Let me give you an example. A couple of days ago, it's 2 o'clock in the morning. I'm getting out of a hospital after a very long day. As I go in, I see one of these outdoor malls that is completely packed with cars, relatively young people, you know, girls with mini skirts. I mean, there is like a party going on. Nobody's wearing a mask. Lots of loud music. And for me, that I have been working 123 consecutive days, non-stop, it is annoying, to say the least. Because, you know, I'm working very hard to save people, and then yet I'm seeing this outside. And the problem, as as we have discussed before, is that everybody's getting a different idea of what is okay and what is not okay. We are telling people different ideas, and nobody's coming in with a concise, you should not do this kind of situation.
Dr. Wilson, I'm the parent of two 13-year-old boys. Allison has school-age kids as well. There was a study out of South Korea. This is a backwards-looking study at the infections in South Korea among younger people. And what it found, looking at thousands of cases, was that the infection rate among kids, middle school age and older, 10 to 16 or so, was about equal to that of adults. In other words, students pass the virus just as much as adults do, and children younger than 10, a much lower rate, but not zero, about half or 40% of the rate. I was surprised to see this based on some of the things we've been hearing in the United States over the last few weeks. What are the implications of this as we plan on opening schools?
And that's the big conversation right now in Hillsborough County. We were supposed to go back to school on August 10th. That's been delayed now to at least August 24th. Last night by midnight, I had to turn in a letter that basically said, do I want my kid to go back to a physical school environment or to an e-learning type of environment? These are really difficult decisions, and they're being made at a point in time where our incidence rate in this area looks to have stabilized in the 45 to 50 per 100,000 cases per day. So that means over 500 to 600 new cases a day, which still means 10 to 15% of those people being hospitalized each day. So very high volumes right now. So not only our children, also the teachers in this area and the workforce of those schools this area, how much can they sustain before they start to see infections? Now, when we think about kids, there's obviously a lot of questions right now about, do our kids get infected at the same rates? And if so, are they able to spread disease? We think about intergenerational spread. So far, what we've seen here in this area, and it may be different in South Korea, we don't know, but what we've seen here is that we have not seen a lot of spread from kids to adults. Not seen that too much yet. We certainly see high rates right now. I think we saw some record-breaking rates over these past 7 days for our children for their positivity rates. But again, very few of those have to be hospitalized, thank goodness. That's one of the few bright spots in this virus. Our kids aren't getting super sick. But when we consider schools, we've got to take into account not just our kids, because we certainly don't want them to get sick. And to Dr. Verone's point, not all of them are going to do well. We are going to have some kids who get very sick if we have a lot of kids being infected, but our workforce, our teachers too. How do we go back to classrooms? How do we quarantine classrooms? How do we isolate when appropriate? Who do we isolate? These are all questions I'm not sure our school districts have a chance to really unwind.
And the South Korea study does raise new questions. Dr. Wilson, Dr. Verone, thank you both for being with us this morning.
Thank you.